In this morning's Health Watch, preventing pancreatic cancer. Each year, about 37,000 Americans are diagnosed with the disease, one of the deadliest types of cancer. Kills 75% of patients within a year and 95% within 5 years. But a study out this morning suggests aspirin can actually help reduce the risk of pancreatic cancer. Medical correspondent Dr. Jennifer Ashton is here with that story for us this morning. Doc, good morning.
Good morning, Chris.
Now, the American Association of Cancer Research describes these findings as significant in quotes. It's a pretty big breakthrough, huh?
Right. Let me tell you about this study. They looked at a little over 2,100 people, divided them up into two groups, those with pancreatic cancer and healthy matched controls, all of whom were over the age of 55. Then asked them to report their use of aspirin, acetaminophen, which is Tylenol, and ibuprofen, which is Motrin or Advil. And they found that those people who took at least one baby aspirin a month, had a 26% lower risk of developing pancreatic cancer, which is significant and potentially very exciting.
You hear a lot about aspirin reducing the risk of cancer, especially colon cancer. They give specifics as to why aspirin is directly related to a reduced increase in pancreatic cancer?
Well, this study, Chris, just looked at an association, so it did not provide cause and effect or the mechanism. But there is a theory that the way that aspirin and drugs like Motrin or Advil work to reduce other types of cancer risk is by cutting the risk of inflammation. Now, interestingly, in this study, they also found a slight reduction in risk amongst those healthy people who took ibuprofen, but it just wasn't statistically significant. So again, the thinking is that it cuts down on inflammation.
I think a lot of people, when they hear just kind of bits and pieces of stories, they hear aspirin, heart attacks, aspirin with something like this. I mean, should people just start taking aspirin just to kind of, be as a safety precaution for
Well, we've heard about it also with reducing the risk of colon cancer, but we need to understand that aspirin, like any drug, has significant risks. And in fact, some doctors say that if aspirin went up for FDA approval as an over-the-counter medication today, it may not get approved so readily. So there are some big risks that people need to be aware of. Number one, it can increase the risk of bleeding internally and in the stomach, as known as gastrointestinal bleeding. It can just cause stomach irritation, which can be a problem. It can worsen asthma in people who have asthma. And most importantly, also, it can interact with other drugs, especially blood thinners. So it definitely has its risks, and people should talk to their doctor about whether those are worth it.
Pancreatic cancer is such a dreaded cancer. Is there any other new developments in the research against anything that you've seen firsthand?
Two big things on the horizon, one having to do with screening, which is looking for something called biomarkers. It's the DNA fingerprint that may be circulating in the blood. The other one, treatment, using individualized vaccines to treat people with pancreatic cancer. Research is ongoing in both of them.
Okay. Dr. Ashton, thank you.
You bet,
Good to see you
Chris.
this morning.